Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. This is Dan Carter. We're back in the studio. For any of you that's ever been here, you'll recognize the studio on YouTube. It's our treatment room. So we turn into a studio. We do. That's where we do our recordings. Like I said, it's where the magic happens. So today I've got, I'm about to say Dr. Caroline.
Definitely not doctor.
Not doctor. We have Caroline Butler with us. This is where it gets confusing. We've got two Carolines and two CBs, so it can get a little confusing around here. But Caroline Butler is actually one of our, I can't say veterinary technician.
Assistant, technically.
Assistant. You're one of our veterinary assistants.
Yes.
So it's a little different today. We're kind of giving you an inside look at veterinary medicine. And one of the things, like, you know, a lot of people think about veterinarians, but, you know, our job wouldn't be possible with our staff. One of the things Jimmy Buffett once said when somebody said, "What's been the key to your success?" He said, "My staff."
Right.
That was the first thing he said, like without hesitation. And I think if you look at any successful veterinary practice, the true heart and soul of it are the technicians and assistants.
Absolutely.
I mean, y'all are what keep y'all kind of the glue that holds everything together. Let's just be real honest here, right?
Most days I feel like that's probably true.
So we kind of want to talk about that and give people a glimpse into the life of, you know, what do y'all do? And that's what we're going today. Is we want to talk about, you know, when you pull up at that equine hospital and you see all these people running around, like, what is it their days look like? You know, what are they doing? So let's start off, Caroline. Like, how long have you been here?
I've been here exactly a year almost now.
1 year.
Next week will be a year.
Awesome. That's really cool.
I came here fresh out of high school. I was actually still in high school.
Were
technically,
you?
Yes, I was. For like an overlapping 2 weeks or something there.
Oh, nice.
And I knew all through high school I wanted to work at Countryside Equine Hospital.
That's pretty cool.
So here we are.
That's pretty cool. So what, so I mean, you've got a pretty extensive horse background, because that's one of the things that if you're going to work in an equine hospital, most importantly, you've got to know horses.
Right.
Like, we can teach you the medical stuff. That's easy. But I feel like horses is something it's kind of difficult to do the on-the-job training there.
It is. I remember one of the first things you told me was I can teach you all the medical stuff, because it is intimidating when you first start. There's it's like this looming mountain of, you know, medical knowledge that you feel like you have to have. But that was one of the first things you told me was, I'll teach you the medical stuff. As long as you can handle the horses, then we'll be good. We'll make it.
And that's the absolute truth.
Mm-hmm.
Like, I always say, you can... If you have the horse knowledge, we can teach you the medical.
Right.
If you have the medical, Lord is forever to try to teach you the horse. Like, this is not the environment to learn horses.
No, it is not.
I mean, you need to have that before you get there. So if anybody's listening, you have a desire to work in the equine field as an assistant or a tag. If you don't have equine experience, go get that.
Yes.
We can teach you the rest.
Best thing you can do is learn how to handle a horse on the ground.
Yes.
On the ground. You have to have that instinct. You have to be quick. You have to know when that horse is looking uncomfortable, feeling uncomfortable, and communicate that to your doctor. So
let's talk about how did your journey start? Like, I think, you know, we've talked, you've been in horses since, I swear, I think by the time you could walk, you were...
Yeah, I mean, I wasn't born in a barn, but I think I got there as fast as I could. And so I started riding about the age of 9. So that's been 10 years. And I started riding at Dabney Riding Academy, taking lessons. And I think in about 3 months, I was on my first drill team. So
cool.
Been on the Diamond D Cowgirls for about 10 years now.
What do y'all, like, drill team? Because that's something a lot of people don't hear about.
A lot of people don't know what that is. So
what do y'all do?
It's like synchronized swimming on horses.
Nice.
You know, a lot of glitter, a lot of curled hair, a lot of lipstick, and we go fast and we look really pretty. Precision is our thing. So we're big on precision and intricate drills and making sure it is very impressive and not just fast. And, you know, that's what we focus on. So I've been doing that for about 10 years now. I started coaching drill team, I think, when I was 16. So I coached for about 3 years, some lower level drill teams, and taught lessons all through that time. And, you know, on the side, I did some lessons on my own independently and some training independently, and, you know, just kind of grew in my horse knowledge and experience, getting experience anywhere I could. I mean, I would go ride any horse. I would go work with any horse, and probably wouldn't do that now, but, you know.
I mean, I remember those days.
Right. And but the medical side of it always intrigued me. And so I remember the first time I saw y'all pull up at the Dabneys, and that was where we met. And I asked you about an internship or something, and you were like, yeah, we can do that like right now. And I was like, well, I need to finish school. And you were like, you can work in college. I was like, no, I'm 16.
Yeah, and that's one of our big things. Like, you got to be 18.
You got to be 18.
Got to be 18.
Got to be 18. So I waited it out and kept in contact. And of course, this was my vet. And right out of high school, when I was going to graduate high school, I sent in my resume and my application, and I got to come in and interview, do a working interview, and here we are. And now I help take care of the same school horses that I grew up riding, which is really cool for full circle moment.
That's pretty cool. So, you know, here we take care of those horses. And so the horses that you started riding on now, you're giving them the best.
That was like the best, like, whoa moment for me, was going and helping take care of those horses.
You know, I think that's one of the coolest things we do is you kind of, like, not just the people, but the horses almost become family.
Yes,
you know,
absolutely.
I think the key to having a great equine team is you need to have some horse passionate, just, you better love it. Yeah. And I think that's what I look at when we're looking for people. It's like, how, because I've always said, like, right, like, horses are not a career. They're not a hobby. They're not something you do. This is a lifestyle.
It completely consumes your life.
It is a lifestyle. Yes. I mean, you can play golf. Right. You can have a dog. Right. You can dabble in fishing.
You do not dabble in horses.
Nobody dabbles in horses. No. This is an obsession.
It is an obsession, a complete obsession. I mean, everything I do.
I think a good, healthy one.
I think so, most of the time.
A good, healthy obsession.
Everything we do, day in and day out, revolves around horses, and I could not be more happy.
It's not terrible.
It's not terrible at all. I mean, we get to do some pretty cool stuff every day. Yeah. So let's talk a little bit about that, because, you know, a lot of people, you know, I feel like if y'all are doing your job really well, no one even knows you're here. That's the goal.
Like, no one even knows you exist if you're doing your job well.
That's the goal.
So let's talk a little bit about what does your day look like? Like, you get here in the mornings. So what's your day?
I mean, most of the time when you're doing this podcast, I'm running around back there getting ready for the day. And as soon as they give me the all clear that y'all are done, I come in here and I'm, you know, cleaning everything up. But, you know, we get here pretty early in the mornings. We get here around between 7:30, and we start planning our day. We look at our schedule, you know, we write down notes for whatever we may need that day, and we start gathering equipment, whether that's, you know, you have a gastroscope on the farm today, you have a lot of equipment to get together for that. You have vaccines today, we're going to go ahead and get those pulled up so that we're moving as efficiently as possible. You know, if we're in-house, we're getting equipment set up that we know we're going to use. We're unlocking all the doors, all the gates, getting ready. We're taking care of hospitalized patients that we have here. So whether that's one horse in the barn or 6 horses in the barn, we go out, their doctors will tend to them. We'll see that they're taken care of every day. And then usually we kind of brief our doctors on what they have to do that day and kind of make sure we're all on the same page so that we're working as a team all day and we're not going 2 separate directions.
Right. No, and that's that is critical, because how the day starts, like I always say, that's the best it's going to be. Mm-hmm. Like how we start, that's the best it's going to be.
Absolutely.
If we start organized, if we start with a plan, and it starts smoothly, that day's going to run smooth.
Absolutely.
It's when it's chaotic. And one thing that I'll tell y'all is, if you've ever been around veterinarians and they look like they got it together, there's a tech somewhere that make that happen.
Yes.
Because most of us, that's not the way we're wired, right?
Right.
I mean, it's not the way we're wired.
Right.
So having the start of that day and having what we need, because Lord knows veterinarians, like I always say, we got to have doctors doing doctor stuff.
Yes.
Doctor stuff's phone calls. You come in the morning, you've got an inbox full of emails that you need to start going through. You've got phone calls to start making. You've got patients in the hospital that need your attention. Mm-hmm. Somebody's got to be prepping.
Right.
Somebody's got to be prepping.
So if I can have your room ready when you walk in, for your first appointment, and there is nothing you need, I have it all right here. Mm-hmm. That means that you can get all that doctor stuff out of the way, because I don't want to do that doctor stuff.
Well, and I think about it too, like you come in the mornings and, we have hospitalized patients and y'all are going through doing those physical exams. Mm-hmm. You're trying to, and we rely so much on that because we see them as veterinarians. We see them for moments in time, but y'all are the ones that are doing, with a lot of the caretaking, y'all are my first sign of like, hey, something's not right.
Right. Because we really do, especially for patients that are here for a little bit longer, build a relationship with them, and we get to know, kind of their personality, and then we can really tell when something's off. And that's very important. Because
a lot of times that's the first sign. It's like something's just not right.
Yeah.
You may not know what, but it's like, I guess that's where that horse sense comes from.
Absolutely.
That stuff that we can't teach you. It's being able to walk in and, I've told my wife when we first got horses at home, and we moved into a house and the horses were there, and my wife's not a horse person. She would look out and said, "Oh, I think so-and-so's colic and they're laying down." And I could look out there and be like, "Oh, no, they're fine."
They're fine.
And then one time they were, and I'm like, "Oh yeah, he is." She's like, "How do you know the difference?" I was like, "I don't know. You just
there's a good lay down and there's a bad lay down, and you better know the difference."
Yeah, you can just look at them. I mean, from 100 yards away, you're like, "That ain't right."
Right. Right. I cannot tell you how many times there's been like a tech in the barn, and it'll be like, "Can you come out here and look at this horse and see if she's just as mopey as I think she is, or am I just?" And we'll all be kind of looking at her, and then it's like, "Yep, we're gonna get a doctor. This needs some attention."
Right.
So.
No, it's and that's the way the day starts. I mean, it's just, the feeding. We have somebody that feeds. The feeding, the grooming, but we got medications that have to be given. Mm-hmm. I joked one time. It was years ago, and I mean, you've heard me say it before. I was like, somebody said, "How do I give this?" And it'd be an oral medication.
And you look at me.
I was like, "I don't know. I haven't given oral medication."
They're like, "Does it dissolve well?" And you're
years. Like, "No, I haven't done it." I mean, it's probably been 15 years since I've given an oral medication.
That means you've had good techs.
That's it.
Yep.
Like I've had great ones. But yeah, so, looking at those in-house cases, and then, like I said, getting things ready, knowing what we need on the trucks.
Yeah.
And that comes with being able to look at the schedule. You can see what kind of appointments we've got.
Yes, that's very important.
And then knowing, like, okay, he's going to probably want an airway scope. Mm-hmm. She's going to need this medication.
Yeah.
Because you're kind of limited, right? We have a truck.
Well, you have a truck. And so, I mean, it's better to, have something that you don't need than need something that you don't have.
Right.
And so I'm always extra. Like, I know sometimes you look at the truck and you're like, "Why are you bringing this?" And I'm like, "I don't know. I thought we might need it. I just have my spidey senses are tingling, and I think we might need this maybe." But we always bring extra. We always bring backup. And even if the doctor doesn't know, there's always a backup plan. There's always, our minds are always moving about what do we need to do next? What do I need to get my doctor? What do I need to do? And but yeah, planning Friday is a big part of that. We all have our clipboards. I know if you have seen us come to your farm, you have seen us with the sacred clipboard, and I don't like anybody writing on my clipboard.
Everybody's always very protective about their clipboard.
Very protective. I have a pen that I like to use, and I have a system that I like, and there's a certain place that goes, and that's how I stay organized all day long. We're making restock lists, whether that is on our truck whiteboard or on our clipboard, and sometimes in our phone, and we are making restock lists so that we can get things ready for the next day and set us up for the next day. We start preparing for the next day the night before. Right. Absolutely. I mean, this is, a lot of preparation goes into one day of appointments.
And that's real. Mm-hmm. Because, I work a lot here at the hospital. Mm-hmm. And so anything and everything I want is no more than like a few steps away.
Right.
Everything's here. But I spent years driving trucks. And when you're on a truck, real estate is at a premium.
Yes.
There's not a lot of real estate in a truck.
No, there's not.
And if you really think about it, when you look at Equine Med, we're going to move a vet clinic to your farm.
Yeah.
And then we're going to pack up that vet clinic and move it to the next farm.
Yeah.
I mean, it is.
And we're going to go to like how many farms in 12 hours? I mean,
we're going to see 5 or 6 farms minimum.
Right. You got to make sure nothing gets left at the clinic, nothing gets left at a farm.
Right.
Everything's packed up properly.
Yeah, you're literally moving a vet clinic to a farm.
Yeah, you are.
And real estate's at a premium, so it's being able to look at that case, look at that schedule. What are we going to need for the day?
Right. Yeah.
Because nothing is worse than when you get out there and you're like,
oh, that sucks.
That sucks. I really needed that.
That's the worst feeling.
Well, and sometimes we don't even know we needed it.
Half the time, I know, we don't even know we needed it. And it's like, man. And then you're like, I wish I would have brought that just in case, Those just in case moments. That's what I throw on the truck, just in case.
I mean, that's not a bad place to be.
Right.
Living in a just in case world.
Yes, so. Absolutely. Always bring extras. But I mean, chances are if you need it, we have it on the truck.
High probability.
You need, bute, we have it. You need anything, Banamine, we have it. Bandage materials, we have it. Snacks, I have some. I'll share.
True. Y'all are really good about snacks, waters.
We are.
More than just make sure we have the equipment.
Yes, absolutely.
So, when patients come in, a big part of your job too is greeting people.
Yeah, that's my favorite part.
Is it?
Yes, I love to go out to the trailers and especially clients and patients that we know very well, and getting to greet them and give them a hug and bring them in. That's my favorite part.
That's cool because that's a big part of people. I often hear this when they say that. I think I'd rather be a veterinarian because I don't like people, or I'd rather be a vet tech or an assistant because I don't like people.
You're going to deal with a lot of people.
The people's our job.
Yeah.
People's our job. You better love people.
You better.
And you better love to serve people.
Yes.
Because that's what we're here to do, is we're here to serve people.
Yes.
So you better have the heart of a servant.
Absolutely.
You
Absolutely.
better be ready to go serve.
Absolutely. And it makes it, we are so blessed here. We have such amazing customers that are just like family. I had not been working here like 2 months probably. And, we were going to these big barns and they were like giving me graduation cards and like, congratulations, I graduated. And they didn't even know my name hardly. I was like, that was such an eye-opening moment for me. It's like, these customers are incredible. And it just makes me want to serve them well and serve their horses well.
Right.
So.
And then, when we greet people and we bring them in, it's, now the work begins.
Yes.
So what are some of the things you do on a daily basis?
I can run down a Dan Carter appointment for you because we've got it. We've got it pretty good now. I feel like I've got it pretty good now. So any patient is going to come in Dr. Carter's treatment room and they're going to talk for a minute. I usually take the horse from the owner so they can be free to go talk to the doctor, look at any images they may have sent in or need to take. And then we're going to go jog the horse always.
Probably going to jog.
He's going to say, let's go run around.
Yeah.
And I go outside with the horse. And so we're going to go jog that horse. We're going to go look at it move, jog, lunge, whatever it may be. Sometimes it's a neuro exam. And then we'll come back in. And if we're not injecting for a performance, a maintenance exam, then we're going to do some imaging. So usually x-rays are first usually, and then ultrasound, stuff like that. Sometimes you're going to block it. So that's the world of lameness. That's the world you work in.
It kind of is. I always say a lot of people say they're intimidated when they first start working because they're worried they're going to, he does a lot of stuff. Well,
once you find the pattern.
Not really. It's all a pattern.
I remember one time, the first time I pulled up to a colic with you, I was like, Dan, I don't know what to do.
You don't see many of those with me.
No, you do not see many colics on Dr. Carter's truck. But so that's usually what we'll do in-house. Usually the appointment involves some injections or some imaging, some blocking. And that's where I keep my doctor safe as well. Even the flexing, my job is to keep you safe, is to put myself between, any danger and you trying to do your job.
Well, and that's something a lot of people don't think about, but we get so focused on the medical side of things. You know, we're trying to figure out what's going on, whether that's palpating something, whether it's flexing something, you know, whether we're looking at something that we're almost laser focused on our task.
Yes.
We don't see the bigger picture.
Right.
We don't see what the horse is doing. We've got no idea how they're reacting. We don't see it.
Right.
And so y'all truly do keep us.
There's a lot of times when, you know, your doctor is palpating something or down, you know, looking at a wound or something, and I can say, hey, he is not liking that. You need to back up. You need to give him, we need to reevaluate, resituate ourselves. Maybe we need a twitch, maybe we need some sedation, but you're about to get injured.
Right.
And that communication is very important.
And that keeps us safe.
Yeah, absolutely. Keeps everybody safe.
Right.
I'm here to keep my doctor safe first and foremost, but there's owners here. Sometimes there's kids here, other horses, myself. We want to keep everybody safe.
Well, and then, you know, when you start training on these things too, it's, you know, we do a lot of scrubbing.
Yes.
You know, whether it's scrubbing joints, whether it's scrubbing for blocks.
Yes.
And you kind of develop this knowledge. Like if we say, hey, we're going to do a low 4-point block, you already know what you got to do. And that just comes with time, figuring all those things out. But that's what keeps us running very efficiently. Knowing what we're going to do next. Like, hey, let's do a low 4. Well, you know what your next task is.
Yeah.
When it comes to imaging, we start x-raying. Y'all take a lot of the images. You know, there's a lot of images that y'all take that we're not involved with because we've got other things that we need to be working on.
Yeah.
And keeping all that stuff on track, knowing how all the equipment works. I mean, I'll never forget, we got a new x-ray machine, and I'll never forget my first weekend on call, and I had a horse coming in, and I realized I had no idea how to run the x-ray machine. And I realized, like, that's how you know you got a good team, right?
Absolutely.
I had to pick up the phone and call Riley. I was like, Riley, how do I work this thing?
Right.
Because I realized that I had never used it by myself.
Right.
I mean, I don't even think I was there for training day because I was like, well, I'm never going to use it by myself.
Right.
And I wasn't there. And I had to call somebody and be like, how do I use this thing?
That's how you know you have a good team.
That's what I tell
Your tech
everybody.
needs to be able to, you know, troubleshoot that equipment too, which is very hard. That's like the hardest thing for me is troubleshooting this equipment. You know, sometimes it's very frustrating, but when in doubt, turn it off and turn it back on. Like, you got to get it working. Like, we have a job to do. You got to get this working, you know? That's the main goal, is to get the job done and get the horse taken care of.
Well, and then also it's like little things that y'all pick up on that we may not see. And one of the examples that jumps out in my mind, I had a tech, Katie. She was actually an RVT, and she worked for me for years. And she diagnosed 2 roars, left laryngeal hemiplegia. She diagnosed 2 of them while we were doing a lameness exam.
Wow.
We got called out. They were in the complaint was just poor performance. And so we started jogging the horse, and, you know, so because lameness is number 1 cause of poor performance.
Right.
So we started there. And so Katie's jogging this horse. We're going through the flexions, and she goes, "Then he's making a weird noise when he jogs." I was like, "What?" She was like, "Yeah, something doesn't sound right when he jogs. His breathing isn't right." I said, "Okay, well, we put him on a lunge. We never got him up to enough speed where I could hear it. But jogging the horse, she's like, he's making noise. He doesn't sound right." I said, "Okay." Grabbed a scope. Lo and behold, both of them, like she's 2 for 2.
Yeah.
Both of them were left laryngeal hemiplegia or roars.
There you go.
And the issue was an airway.
Yep.
But she had jogged, you know, the Lord knows, probably thousands of horses.
Right.
And she's like, we'd had one that was a roar, and she'd remembered what that sound was. And because when you're jogging the horse, they're right there in your ear.
Yes.
She was picking up on that subtle noise. And sure enough, she was the one that found the problem.
Yeah. And I mean, there's a lot of times when, you know, a tech is lunging a horse and you're going to ask me, you know, is he pulling more one direction? Is he leaning? What are you seeing? What are you feeling that you can't see from outside the circle, or that you can't see because you're not the one jogging the horse, you know? So there's insight that your tech can give you that's very helpful.
Yeah, because that's a big one too. Is like they may be going around in a nice circle on a lunge, but you're like, my arm's tired. He is pulling on me.
They're pulling me.
And it's like, oh, okay, well, something's not comfortable because we're trying to counterbend.
Right.
And y'all give us that information.
Well, something too that I think is very important and very unique about our clinic is that we have people from so many different disciplines. So many different disciplines. I mean, you've had techs that have done it all, you know, and you work on all disciplines. And so having that helpful insight to those specific sports can help you diagnose a horse.
Absolutely. Because you have to, if you really want to do performance meds, you have to understand what your horses are doing.
Absolutely.
Whether that's dressage, reining, working cow horse, jumpers, Arabs, you have to understand the discipline.
Yeah, absolutely.
Because if you understand the discipline and what it takes to do that, it really does help us.
It really helps. And, you know, I might know what this rider is struggling with because I've done the same thing. If, you know, you have a jumper working through something, I'm probably not going to be any help because I don't jump. But we have other people here who do.
Right.
And they might be able to provide some insight to that, which I think is really cool.
No, that's those little things that, like I said, y'all are doing what you're supposed to do.
Right.
Nobody knows you exist.
Right.
But those little insights, and you know, we listen to our techs and our assistants. We listen to them. We pay attention. We don't discount anything you say because y'all are part of the team.
Right.
Y'all are 100% a part of the team.
Right. Well, and I mean, as a tech and a doctor, you're going to spend a lot of time together. You're going to spend hours together in a truck, in a treatment room, whatever it is. And so you have to trust each other. You have to trust, you know, I know that you've got this is your job, and I know you're going to handle it. And that's important.
And then, like, some of the other skills that y'all develop, because, you know, that's the other thing. Your job is to make our day flow better.
Yes.
I even thought about the other day, I don't think I put a catheter in, and I really don't know the last time I put a catheter in. I'll be real honest, because
I don't remember the last time you put one in either.
And I talked to friends of mine, they're like, you don't put catheters in? I was like, man, I ain't put a catheter in 10 years. You know, we get ready for surgery. It's like, y'all just want to know what sides the horse need to be on.
Yes.
And then like, all right, we'll put the catheter on the left side. Next thing I know, everything's prepped and we're ready to go to the OR.
As long as we know what side to lay them down on, we can usually get everything ready. We have a good team that can, you know, we have a team that's fixing the surgery suite while somebody's putting the catheter in and, you know, grooming the horse, getting everything cleaned up and ready. And, you know, you come in, you go over our surgery plan, and we go.
That's it. And that's a big thing that y'all help with is when it comes to surgeries, because, again, we're the one doing the surgery. Well, somebody's got to run anesthesia.
Right.
Our technicians run the anesthesia. They go through a pretty intense training program to get to that point where they can run anesthesia. So we put y'all through a pretty intense training program. And then you got our surgery techs, you know, is what we call y'all. The surgery tech's one that, you know, if we need them, they'll assist. They make sure we have what we need in the OR. If we don't have it, they go get it for us. They're also helping out with anesthesia. If the tech run anesthesia needs a set of hands or needs somebody to do something, y'all are pulled over there.
Absolutely.
It's like juggling.
Well, that was one of the things, you know, when I was being trained, I was like, what does a surgery tech do? Like, what do you do in surgery? And I remember Riley was like, you are the dirty hand. Like, you are not sterile, so anything that needs to happen is your job, you know? You might clip the horse, you're going to scrub the horse, you might, you know, help lay out drapes, whatever it is. Like, you are the dirty hand. You're doing everything but surgery. You're doing everything but perform that surgery.
Right.
So,
and there's times where it's like, hey, I'm going to need you to scrub in.
Yeah.
And you're scrubbed in, you're sterile, you're helping us out. There's, like I said, anytime you're working on a horse that's that big of an animal, you've got to have a team.
You've got to have a team.
I mean, just getting them on the table. It's 4 people to get a horse on the table.
Yeah.
Like, it takes 4 people to be able to.
And it's like you have to move efficiently. There's no option but to move quickly and efficiently to get a horse on the table. Everybody has to know their job and do it well.
And that's, you know, I tell everybody when you're getting ready for your first surgery, I was like, all right, this is your first one. Just accept the fact that you're going to feel like you're in the way.
Yes.
You just feel like you're in the way.
You are.
And that's what you're going to feel like.
Yeah.
Because you try to explain the process to someone, but until you do it.
You just have to do it. Seeing it doesn't even, you have to do it.
You got to do it.
You just got to jump in there and you got to get in the way and you got to do your job. Like, you know, I'm a very, like, I like to be organized. And so my list of things in my head that I know I have to do in surgery, you know, I'm like, this is my job. And if somebody's in my way, I'm like, I got to do this. I got to be right here. You know, that is my job. I have to get this done so that we can get this surgery done.
Right. And so it's funny because after that first one, you can always, as soon as the horse is on the table, you kind of look at him. Everybody's got that same deer in the headlights look.
Yes.
It's like, how did this just happen? Like,
what do I do now?
Yeah. But once you get past that first one, you start to pick it up.
You do.
And a few later, next thing you know, you're one of the ones that's in there that's just getting things.
It takes a lot of them. It takes a lot of experience to get comfortable doing that. But once you get your steps down, we're big about our steps here. Mm-hmm. Once you get your steps, you can kind of cruise and you're good.
Yep, getting the process.
Yes. Process is very important.
We're all about process. If we can systematize something, we do it.
I love it. I think we did like 3 surgeries in 3 weeks just this last month. And it was so funny. The last one we did, we went to lay the horse down and you didn't even assign, you're going to be here, you're going to be here, you're going to be here. We all jumped in our spot that we knew we had and just laid the horse down while we're having a conversation, hooked it up, we're talking, wheeled it in there. It was like we all jumped in and knew exactly what we were supposed to do.
No, that's when your team's flowing great.
Yeah.
That's things are great. Let's talk about some of the other jobs. We talk a lot about equipment. Mm-hmm. I mean, y'all have to be like amateur IT people.
Oh my goodness, yes.
Yeah, when equipment's not working, y'all have to figure out how to make it work.
Yeah.
Like, why is it not working? Y'all have to go through and troubleshoot.
Yes.
And make sure equipment, because I don't know what it is. If it's electronic,
it's going to break.
It just breaks.
At the most inconvenient time.
Yes, every time.
Every time. I mean, I remember one day, like you and me were trying to shoot an X-ray. It was like the last view, and the thing started updating, and I was like,
I remember that.
I'm gonna lose my mind.
We had like one view left.
One view left.
It was a pre-purchase, like 54.
Yeah.
We shot 54 films, and the last film,
I was like, I'm gonna cry. This is terrible. I was like, can I turn it off and turn it back on?
We're just stuck.
You just have to wait.
Yeah, we needed one more view.
We did.
But yeah, so I mean, making sure that equipment's up and running. Making sure that it works appropriately.
Yeah.
Because I don't know what it is. And it's funny, my mom managed an operating room. Mm-hmm. She was a nurse manager in OR for just shy of 40 years. Shout out, Mom, if you're listening.
That's awesome.
So she would talk about doctors when equipment didn't work. Mm-hmm. They're like throwing little temper tantrums and fits.
Yeah.
And I kind of laugh because the same thing happens in our world.
Yes.
It's like, what do you mean the ultrasound's not working?
Yeah.
What do you mean the x-ray's slow to load? Fix it.
Yeah.
Like we start throwing our little temper tantrum. And like you have some kind of control over this. Like you're Steve Jobs and you built the ultrasound.
Right.
But y'all just always find a way to
figure something out.
Get it working.
Yeah. I mean, I remember one day I knew your ultrasound cord had stopped working. And so, I took it out. I got you a new one. And it was like 3 weeks. And you were like, this is not my ultrasound cord. And I was like, yeah, it is. And then ended up, we had not used it plugged in. And when we used it plugged in, that cord wasn't working. And I was like, well, shoot. So now we got to figure something out. But it was 3 weeks before,
I had no idea.
That's the goal.
Yeah.
That means we were doing a good job.
And I mean, I use my ultrasound a lot.
Multiple times a day, every day.
I had no idea.
So
the dirty power came through. And I was like, oh, this is gross. We got to fix it.
We got to fix this.
Because, we won't even get into that.
No.
Megahertz and frequencies, but yeah. So, and then and one of the things you said is like, I remember never forget when you said in 12 hours.
Mm.
A lot of people don't realize this. If you look at small animal, most of those are 8-hour shifts.
Yeah.
You're cranking 9 to 5.
Yeah.
We tell everybody when you come to work here, we start at 7:30.
We finish when we're done.
We finish when we're done.
Yeah. It might be, on a rare occasion, it might be 8 hours.
Mm-hmm.
It might be 10. It's probably going to be 12. It might be 14.
Yeah.
Maybe it's 16.
It's when the day's done.
It's when the day's done. Do not make plans after work.
No. And that is Equine Med.
It is Equine Med. If we're going out to do something after work, we're going out with somebody that we work with. Because we got off usually around the same time.
And that's important. We always say it's the job starts 7:30 and ends. Was that whole thing 7:30 till?
Yeah, till. ...
Exactly.
Yeah.
Because even once we get back, it's the end of the day. Even once we get back and we're wrapping up,
there's so much to do.
Now the second third of the day starts.
Right. So you have your preparation part, which is in the morning, which is my favorite time of day, when everybody is back and forth, because everybody's at the clinic.
Right.
And everybody's back and forth, and that's my favorite part of the day, because you can be with everybody and you can see how well we're working. And so we prep our day, and then our day starts and we go through all of those hours, all of those appointments. And then either we get back to the clinic or the last appointment leaves. And I mean, we have just blown up a treatment room. Like, I'm like, sometimes I come back in here and I look around and I'm like, oh my gosh.
Well, and everything looks clean on the surface, but there's still like, is restocking everything.
You've got to get that restock card in here. You have to go through every cabinet and make sure it's filled, or you've got to go to the truck and you've got to get blood work off. You got to go get that running. You got to transfer ultrasounds, x-rays. You've got to bring that card out there, restock medications, restock supplies, so that we're ready again for the next day. And that's when we start prepping for the next day.
Well, one of the things I think is really cool when you talk about how well y'all work together as a team is, I had no idea this was even happening, but if when techs are out on the road, y'all are figuring up a restock list, and like that last appointment, I didn't know this, but y'all send out a message.
Yeah, we do.
And whoever gets back to the clinic first starts getting everybody's restock.
That is like the biggest blessing of my life. Like, and usually it's like me and Destiny sending out like a long list, and you know, that is like, we get back at 7:00 or something, and I walk in Central Supply and I see all my medications sitting there, and I'm like, oh, I love y'all.
You don't have to pull them from inventory.
You don't have to pull them. You don't have to sign them out. You just take them to the truck and start restocking, and that is one of the like beauties of our clinic.
And I laugh because I mean, been working here for years, and I think I just found out like 8 months ago this even happens.
Yeah.
But that's how well y'all are all looking out for each other.
We are.
How do we make somebody else's
We are
day
big
better?
on team.
Yes.
Very big on team.
That's one of the first things we tell people when you come to work here. If your priority is not team, if your priority is not serving customers and serving your team, this is not your place.
No.
You're not going to be successful here. We don't even need to go through an interview.
Right.
If team is not what you're all about, team and serving. Yeah. Serving customers, serving your team. If that's not your number one and number two priority,
it's not going to work.
It's
funny because when I think I started last March, and it was like an instant like click, and I just felt like I was part of the family, and like I had gained so many new best friends, and by October, so I met all of these people in like March. By October, we were all at Dr. Caitlin's wedding together.
Right.
I was doing her, wedding makeup. Like we were all, and I was like, I looked around and I was like, how did I get here? Yeah. It's like, if it weren't for Countryside, I would not be here. And that's awesome. We celebrate all of our big personal milestones together because we are a family. And that's one of my favorite things.
I think that's a big thing when I talk to a lot of my friends that have equine clinics. Like, I don't know if it's the long days together or if you're all in the same boat together. I don't know what it is, but equine teams literally become they become families. Yeah. They're all going to be friends. Yeah. And I mean, they can have a little dysfunction in there, but that's okay.
Every family has a little dysfunction.
We're still family.
We're family. Yeah. And I mean, like I said, we spend a lot of time together, so we know everything about each other. I mean, if I'm going by the coffee shop on the way here, I know your order. I'm going to pick you up one. It's like things like that. Like, I know she's going to like this, or I know she needs help with this. I know she struggles with this, so I'm going to help her with this.
Right. And then let's talk about, to me, this is the part I think that amazes me the most about what y'all do. So you may be working with me 3 days this week, and you may be working with another vet one day, or you could be working with 3 different vets for 3 different days. And if anybody's ever been around veterinarians, we're all type A.
Yes.
And I tell everybody there's only 2 ways to do anything. There's my way and the wrong way.
Yes. Heard that a time or two.
Yes. And we're very particular about everything. We like our way of doing things. And when it's not done that way, we start to get a little, it's that type A kicking in, right?
Yeah.
We get all fidgety and
tism a little bit.
It's bad.
Like...
And y'all have a way of learning every doctor's individual preferences and making sure that you do it for that person.
Right. Yeah. It can be a little like a whirlwind going from one truck to another, which, a lot of the time we're with more one doctor than another, but we do bounce around a little bit. And, so you learn what that doctor likes, what that doctor needs, if that doctor is a little more organized, if that doctor's not as organized, it's crazy. I remember I was on Dr. Caitlin's truck one day and I was like, where is my clipboard? I was looking for my clipboard. I was like, I cannot find it. And she was over there writing away on it. And I was like, what are you doing? And she was like, I'm writing on my clipboard. And I was like, that's mine.
That's my clipboard.
That's my clipboard. Yeah. She was like, no, I write my notes on here. And I was like, okay, that's all right. That's fine. Yeah. I'm just going to drive and we'll turn on some music and I'll forget about that.
Yeah, I don't touch the clipboard.
No, Dan does not touch the clipboard.
I do not touch the clipboard. But yeah, and so, I mean, that's always kind of, because, I mean, it varies. Like, if you ride with me, something's probably going to limp. You're going to jog something. Yep. You're going to x-ray, ultrasound. Mm-hmm. If you're with Dr. Brown, you might do some repro. You might look at an eye. Mm-hmm. You know, you're probably going to get into some crazy stuff. I swear. Caroline's truck. She can attract some, like. Oh, my gosh. Caroline's truck is like the craziest. Like. She's the magnet. She's the magnet for crazy. I swear. We had a case in here and somebody was, she's like, Dr. Brown's so great. I was like, no, if you've got a disaster, Caroline she's the one. Oh my gosh. And she does it without you even knowing. Like, she just starts like mumbling to herself and like doing stuff. And I'm like, what are you doing? And then she's fixed it. And I'm like, she thrives. Like, the crazier like the thing, like if it's a story that should make Facebook, it's probably hers. It's probably Caroline's. They find her. They do. And she is the one you want. Yes. Like, she is the ER. Yep. Trauma doctor of the equine world. Yes. That is like her. So that's her truck. Okay. It can be a little more chaotic at times, but you know, it's nice to mix it up every now and then. I was with her yesterday and I was like, whoa. Yeah. Whoa. What are we doing? You were in repro land yesterday. I was deep in repro land yesterday. Yes. And but then you have Dr. Caitlin's truck and she's very type A. She's very organized, you know. And we have a lot of fun on her truck too, but Dr. Caitlin's truck is like the long day truck. Yeah. She gets back late, I swear, every day. I know. I remember we were starting out dental month, and me and Jordan went with her to do a barn, and we left. We had like 3 emergencies at that barn, and then we left there and did another emergency an hour away. We got back at like 9:30, and we like all walked in the door with like this glazed over. We were like, oh my gosh, what just happened? But that sums up Caitlin's truck. And we had fun the whole time, you know? Absolutely. We were singing, we were talking, we were getting our job done well. I mean, we had a great day, but that's Dr. Caitlin's truck for you. Mm-hmm. No, they're all different. And like I said, the fact that we're all very particular about how we do things. Very. And y'all can remember all that. And then, you know, it's the little things too. Like we get back at the end of the day, if you've been on the road, and then there's, you know, 20 samples that have to get submitted. I mean, everything from Coggins to routine blood work to specialized lab test. And I'll be real honest, I don't know where any of it goes. I don't know how it gets done. And I thought about this the other day. Like, I got back and we were on the road that day, and I had a bunch of tests that had to go out. Mm-hmm. And I remember results started coming in. I was like, I don't even remember. I said, hey, we need to get y'all go do a Cushing's test on this horse. I mean, not only do y'all get all the samples and submit everything, but you're making sure it all got out, got to the lab. Mm-hmm. And it's one of the greatest things in the world because I never worry about if that gets done. It just does. Yeah. And I don't even know how. Right. But I'm very pleased about that, by the way. Well, that means we're doing our job. I mean, if a doctor came in the lab and tried to help us send out samples, I think we'd be like, no. Yeah. No, go away. You know, it was years before I knew you had to work a blood work machine. I'm dead serious. And I remember I needed on emergency one time, and I was like, it's midnight. I've got to call somebody. Yeah. Because I don't know how to. That's why we have the how to now. That's the reason we do is because I had never done it. Yeah. And I remember thinking, I was like, somebody's got to write this down. Yeah. Somebody has to write it down. We have instructions on pretty much everything. It's foolproof. So. But yeah, the way y'all are able to keep everything going, keep everything flowing. And then there's also the other side where there's a lot of, what do you call it? Hand holding and hair brushing. Hand holding and hair brushing. That's it. That's the people part. Mm-hmm. So you have the horses and then you have the people, but you know, we build relationships with the customers just like y'all do, and with the horses, and you know, you go through a lot of hard times with those people because like you say, our best day is their worst day. Right. And so, you know, we may be having a really cool case, we're having a great time, but they're watching their horse go through this and this is terrible. And so, you know, just slowing down to talk to them and, you know,
some days people just need a hug and just need somebody to talk to. And if I can be that person, then I want to be. Sometimes they bring their kids in and y'all need to focus on a conversation. And I'm like, hey, I can take the kids. We can go find something cool to look at or talk about. And
I know everybody thinks the Play-Doh's for packing feet.
It's for the kids.
It's for the kids.
The kids refer to the recovery stall as the trampoline room.
That's it.
So we know about the trampoline room. Sometimes we go in there and, we keep kids entertained while y'all are having a conversation or whatever it may be. But that's those relationships that we build with them.
Y'all teach them where the candy drawer is, where the snack drawer is.
The candy drawer, it's getting a little empty. We're going to have to refill it. We've had a lot of kids in here.
I know we got to get that refilled.
Yeah.
And I tell you, it's amazing the confidence y'all can inspire in people, because I'll never forget going out of town and I was like, look, I'm going to send my intern up. Like it was something like a shock wave, or I needed to get a quick sample or something, or need a treatment done. And I was like, look, I'm going to send my intern up. These are licensed veterinarians, but they're the first year out. And I was like, going to send my intern. And I'll never forget the customer was getting nervous. It's like, oh, don't worry, Jamie will be with them. And that was my tech at the time, Jamie. Or I'd be like, don't worry, Riley's going to be with them. Don't worry, Caroline will be with them. And they're like, oh, okay.
It makes it okay.
Yeah, it's like
a familiar face.
Yeah, it's like, I'm going to send you this new vet.
Right.
Who's completely licensed, qualified, and able.
Or you can have Caroline.
But don't worry, I'm going to send my tech with him.
Right.
Like, oh, your tech will be here? Oh, yeah, that's good.
Everything's great.
Everything's fine.
Everything's fine.
It's like, because they know the horses.
Right. Yeah. We know our way around most of our regular barns. We know what sets what horse off. And so, yeah, that's one of our other, our other jobs with the owners is a lot of time trailer loading.
Yep. Y'all do have to help put them on trailers.
We have some trailer loading wizards around here.
That is definitely true.
So
what always amazes me, they get on the trailer and come here, no problem.
Right. But once they're here, we're just, Countryside Equine Hospital is that great. They don't want to leave.
That's my thought. They just don't want to leave.
They don't want to leave. But,
so, yeah.
And a lot of, owners can get very flustered about that. And that's a kind of a panic moment for a lot of people. But we can be like, you know what? I've seen this 4 times today.
Right.
You go inside and get a coffee and we're going to get him on the trailer. We'll have him on here when you get back out. It's no problem.
That's it. So, yep. So if you ever wondered, if all our listeners out there ever wondered, like, who are these people that show up? They are truly the glue that holds our team together. I mean, they do everything. And so, we really appreciate all y'all do. And it's funny because every doctor that comes here that isn't used to having a tech with them every day, as soon as, like, within the first week of having a tech, they're like, oh, I can't do this without them.
Right.
I was like, I'm well aware. This is truly what makes this day function and makes the world work. So thank you for all y'all do.
Of course. We can't do our job without y'all either. I mean, it's a blessing to work here and to have amazing doctors to work for. So
yeah, it's a pretty cool place. So.
It is.
So that was a little bit of a day in the life of what do these people do that show up with your veterinarian?
Yep.
This is what they do.
We are not the fairies. We are the techs.
That's it. And assistants.
And assistants.
And assistants. So.
The techs and assistants. So.
Yep. So, well, thank y'all for listening today. April, thanks for recording all this as always. And Casey, thanks for doing all the editing. And I'm going to keep remembering, I'm supposed to start saying, like, you need to like and subscribe.
You need to like and subscribe. We have social media.
Yes.
Facebook, Instagram, and TikTok.
Yes. And YouTube.
And YouTube.
And Spotify.
And Spotify.
And Apple. Anywhere that you can hear a podcast, I think we're on. So
if you have a phone.
Yes. So like and subscribe.
Yep.
And if you don't want to like and subscribe, don't like and subscribe. We just want you listening because, like I said, our job is to educate you.
Yep.
That's the whole point of this podcast. We have fun.
We do.
We have fun doing it. We love to educate people. We want to make the world a better place for horses.
Absolutely.
That's our whole goal.
Take care of the horse.
That's it. It's all for the horse. So thank y'all for listening. Thanks to this awesome team for making everything possible. From all of us here at Countryside Equine Hospital, y'all have a great week. Take care.
Bye.